Greetings, folks. This is Neil Murphy. We welcome you to our Easy Sell Solutions weekly podcast. And this week we will be covering up how to set up your own practice. As we all know, there are various components to start your own business and your own practice. We will be guiding you through the entire process step by step. Step 1. Here are the things which you need to start your company. You need to decide on a very good, unique practice name, which does not clash with anyone else's domain. You have to decide what type of a business or a company you wish to establish. It can be an LLC, it can be a PLLC, or it can be a PA, which is Physicians Association. You will need a registered address to receive a lot of mails. You will need a unique phone number as well, which your patients can remember easily. Also has to be connected with bank accounts and several different accounts for insurance purposes. You will also need a fax number to receive important notices and documents from insurance companies. Let's move on to step 2, registration of your practice. Registering your company is fairly simple. There are numerous websites which will help you register your LLC or PLLC. Once you have registered your company, there are 4 things which you will have obtained. First would be EIN number. It's Employer Identification Number. Second, tax ID. To run any business in the United States, you require a genuine tax ID. Third would be W-9 form. It's a document issued by IRS. Fourth, effective date of commencing your business. This is only used for insurance purposes only. Let's move on with step number 3, creating your type 2 NPI or group NPI. Even if physicians have their individual NPIs, it is very important to have a separate type 2 or a group NPI. It's a frequently asked question, why do we need another NPI to start our business? An individual NPI is connected with the social security number of the individual physician, and type 2 NPI is registered with the tax ID as we covered in step number 2. A practice is an entity of its own. It will have its own separate malpractice insurance. This is very important because in case in the future if there are any litigations or lawsuits, they will be directed towards the entity and not the individual provider. If in case an individual provider decides to expand their practice, a group NPI works best. In case physicians decide to hire more providers or wish to have a multi-specialty facility, type 2 or a group NPI is necessary. Easy Sell Solutions help all practice owners register their group NPI. Beware, this service is absolutely free and provided by the government. So make sure you do not pay a single dime for this service. Also, as far as turnaround time is concerned, you will receive your group NPI within the next 24 to 48 hours after registration. Let's move on with step number 4, credentialing services. What exactly does credentialing means? To accept patients with active insurance with eligible benefits with a specific insurance company. To bill for such patients, the physician has to be in network with these insurance payers. This process is known as credentialing services. As physicians start accepting patients, they need to understand what does a payer mix means. A patient may have primary as well as secondary insurances, as well as federal and commercial insurances. Federal insurances are Medicare, Medicaid, and commercial insurances are BCBS, Aetna, Cigna, and there are a huge number of insurances out there. Depending on the state and county, it is important to understand which insurance companies to be in network with. For example, a patient may have a separate payer mix of primary, secondary, and tertiary insurances. The primary insurance can be a federal insurance such as Medicare, Medicaid, and secondary and tertiary insurances could be commercial insurances such as BCBS, Aetna, Cigna, and there are multiple insurances. Main concern for the physicians is not to leave any money on the table. In case a patient has 2 separate insurances and the physician submits only one claim as a primary claim to Medicare or federal insurance, the remaining amount will be left on the table and the physician may lose a lot of money. Here at Easy Sell Solutions, we help our clients getting in network with both federal and commercial insurances. There is separate payer mix and separate packages to start the credentialing process. Here are the components which we need to start the credentialing process. First, registered practice name. Second, registered practice address. Third, a registered phone number. Please understand, registered phone number is very important because you will receive a lot of calls from insurance companies to confirm certain things. And if you do not use an active phone number, your insurance process or credentialing may get delayed. 4. a business tax ID, which we have covered in point number 2. A business EIN, employer identification number. At Easy Solutions, we provide a separate credentialing checklist which consists of a lot of different points such as DE certificates, malpractice insurances, date of birth, social security number of the physician, CAQH and PCOS. CAQH and PCOS logins are very crucial because CAQH will have all the necessary information for the practice as well as the physician. PCOS is only needed if the physician accepts Medicaid patients. A frequently asked question about credentialing process timeline. A standard timeline is anywhere between 45 to 90 days. But here at Easy Solutions, we try to follow a strict guideline and try to reduce your timeline by significant amounts. You need to understand every insurance payer has their own set of standards and set of timelines. For example, Highmark completes the entire credentialing process in about 180 days, starting from the date of submission. But there are also commercial payers such as Aetna, BCBS, Cigna. They finish your applications and provide you effective dates within 20 to 25 days. Everything depends on how the application was submitted and if there was any missing information or any rejections in the first attempt itself. Let's start with step number 5, installing billing systems. As we know, the credentialing process is ongoing. It is very necessary to establish some SOPs, the standard operating procedures, which need to be set and implemented. To have a smooth billing operation, you need to have appropriate tools. There are plenty of billing softwares out there where you can choose from. Every specialty has its own customized EMR and EHR to serve the needs of the practice. There are certain tools which help the physician in certain processes. For example, OncoCharts has the ability to upload radiology charts of the patients for the physician to understand. Tebra earlier used to be known as Cario. It has the ability to merge your scheduling software, which is PatientPop, with the billing software Cario. Serbo has an ability for the patients to upload their health cards or insurance cards directly on the portal before choosing any appointment slots. Here at Easy Solutions will help you choose the best EMR EHR for your practice. Choosing the appropriate EMR EHR is the key to keep everything organized. You have to take the annual budget into consideration and understand buying an expensive EMR, EHR or billing software is not going to help you with smooth billing operations. You have to take the monthly expenses and overheads cost into consideration as well. Let's start with step number 6, setting up standard operating procedures. At Easy Solutions, we design and customize standard operating procedures for each and every client separately. This helps us streamlining the entire processes for the smooth operations. There are numerous teams which work on these processes. On the screen, you can see the list of services which we provide, and let's start discussing them one by one. First, insurance verification and benefits check. There are 2 ways to complete insurance verification process. It can be a real-time insurance verification or it can be a bulk or back-end insurance verification. The real-time and live insurance process is used by facilities which have a higher volume of walk-ins. Within a minute, this real-time software will provide all the information related to patients. You just need 3 things from the patients: patient's name, date of birth, and their health information. If a practice works on appointment basis and cannot check real-time insurance verifications, they can send Easy Solutions the list of appointments they'll be having in the coming week or the month. Our insurance verification team will provide them all the necessary data which can be automatically uploaded to their scheduling software, which will help them get all the information from the patients and enter the demographics accordingly. Let's move on to the point number 2, which is prior authorization, or also known as pre-auth. There are certain operations, there are certain procedures like surgeries which need pre-authorization from each and every insurance company. As we know, insurance companies work on a very strict guideline and documentation. If the pre-authorization certificate has not been submitted, the insurance payer is not entitled to pay your facility any money. Let's move on to point number 3, patient demographics. The operations team is responsible to collect all the information from the patients with their name, date of birth, and insurance information. This helps in the claim submission process. Next would be billing. Operations team is entirely responsible for creating CMS 1500 or HCPA forms, which are later uploaded with medical records and signed off by the physicians. There's a rigorous claim scrubbing done to make sure all the blocks are filled in the CMS 1500 form. In total, there are about 36 blocks which have to be completed. Even if you miss out on a single HICPA form block, the clearinghouse will deny or reject your claim. And this moves or goes on to the denial management team. The fifth process would be coding process. The coding team is responsible to check all the ICD-10s and CPT coding. Each procedure has its own CPT code along with a specific modifier or a modality. If modifier or a modality is missing in the HICPA form, the claim will get denied or it will not be paid as per the reimbursement set by Medicare. Let's talk about denials. Point number 6, denial management. There's a dedicated team at Easy Settle Solutions for denial management separately. If any claims are rejected or denials, a team of experts promptly act upon the rejected claims. Any rejected claim has to be overlooked within the first 24 hours. If any rejected or denied claims are left unattended, they probably land up in AR, and if a timely filing limit of 180 or 365 days hasn't been fulfilled, the money is lost on the table. Let's move on to point number 7, AR management. AR is also known as accounts receivable. Accounts receivable team is very much responsible to collect all the insurance money or revenue from insurance payers. Every insurance has a specific timely filing limit. This timely filing limit is known as the time which insurance companies provide you to submit or resubmit any applications. For example, Medicare provides 365 days, which is almost a year, but majority of the commercial insurances only provide up to 6 months, that's 180 days. It is very important to understand if any of the rejected claims are not submitted within this timely filing limit, the money is lost. AR team is very much responsible to retrieve as much revenue as possible from these insurance companies. These accounts are also known as legacy accounts. So some practices, if haven't attended any of their claims for about 6 months plus, it is very difficult to retrieve any amount from the insurance companies. Now let's talk about point number 8, payment postings and charge entry. Once a practice starts receiving money from insurances, it is very important to keep them organized and keep a track of the revenue. The operations team or the billing team is responsible for payment postings in the billing software to understand and compare how much are the charges being entered and how much is the amount of money which is received from insurances. Along with that, there's a payment reconciliation team which helps keeping the steady cash flow and also payment reconciliation to keep track of all the revenue which has been happening. Let's come to the last point, which is accounts. Here at Easy Settle Solutions, we try to simplify your billing and amplify your revenue. So you need to understand if you aren't making any money, we aren't making any money as well. At the end of every month, the accounts team will create a specific dashboard for each and every client, which makes the client understand what's their weekly production and what's their monthly collection. Everything has been given with rigorous reports, exhaustive reports about everything, aging reports, accounts receivable reports, and a ton of different types of reports. Once the client is satisfied with the revenue and all the reports, the accounts team will generate a specific invoice end of the month and charge based on a specific percentage which is allotted to each and every client during the initial meetings. Coming down to conclusion. So far we have summarized the entire end-to-end billing cycle and revenue cycle management for potential practice owners. We encourage new business owners, new practice owners to start their business, and we will make sure we help you from start to end. In today's video, we've covered how to set up a solo practice. If you have more questions or if you need more information about multi-speciality or group practices, you can comment on the video below. To have similar information, stay tuned with us and follow for more content. Thank you for watching.